It's Friday. You made it through the week. And on Friday, besides hearing about your good news, we like to take the time to go back through our inbox and answer any of the questions we may have missed throughout this week. So let's get right to these, and of course you can send them anytime. This from Rhonda, who asks, has anyone heard any more about a Moderna booster shot? Well, the good news for you, Rhonda, both Moderna and Johnson & Johnson have both submitted requests for emergency use authorizations for their booster shots, but as of right now, they are still not yet available. Now, only those who got the Pfizer vaccine and are older than 65 or have underlying medical conditions are eligible for the most part to get a booster shot. That shot must come at least 6 months after a 2-dose series. The FDA is expected to meet next week to review Moderna and Johnson & Johnson data on the booster topic. Both the CDC and the FDA would have to sign off on the decision. Our leaders at the Department of Health and Welfare say that they know it is being studied closely and they're hoping to learn more by the end of October. All right, another question for you. Can you give an update on the monoclonal sites available? No problem. So right now, there are 3 state-sponsored treatment centers. 2 are now open, one in Idaho Falls, one in Coeur d'Alene. 32 hospitals across the state of Idaho are also offering the treatment, and that includes both St. Alphonsus and St. Luke's. In most instances, you must test positive for COVID-19 and have a doctor's referral to receive these treatments. Make sure to talk with your doctor before seeking this treatment, and we should note that the treatment should not be used as an alternative to getting the vaccine, which is still the most effective guard against the virus. The monoclonal antibodies is supposed to keep COVID-positive patients, or those who have been exposed to COVID, out of the hospital. Now, as of today, the monoclonal antibodies have been approved by the FDA under emergency use authorization, but have not yet received full FDA approval. Idaho medical experts tell us again, getting a vaccine is the best option. It is a better option than having to eventually get monoclonal antibodies. The COVID-19 vaccines are both safe and effective. All right, let's cover one more question for now. Brandt asks, what about those contempt of court charges for the lieutenant governor? What became of those? Well, those are still in the works, and a quick recap for you. Several media outlets requested documents from the Lieutenant Governor's Education Task Force. Now, earlier this year, she asked the public to submit their comments about the alleged indoctrination in our public school system. Now, her office denied those record requests. So the Idaho Press Club sued her office, and in a court of law, they won. A judge then ordered McGeehan to release those records, but she failed to do so initially. She eventually asked the judge to reconsider his decision, but that was denied. And as until last week, when the Idaho Press Club asked the judge to hold her in contempt of court for not complying with the order. One day later, the lieutenant governor did release those documents, but she still is scheduled to appear in front of a judge next Wednesday, at which point the judge could decide to hold her in contempt for not initially complying with his order.